Let's talk about nature versus nurture, or how genetics and lifestyle are connected. Health and happiness are influenced by many things. Things that we choose, as well as our circumstances and outside influences. We often don't even realize that we are influenced or manipulated through health claims. And that's true for patients, but even for healthcare professionals. The question is, are you going to be taken on a roller coaster ride in life, or are you going to be in the driver's seat as much as possible? In order to nurture your health, you need to know what matters most. So we'll start by having a look at the state of health and happiness in the US today. But these trends apply widely in ever larger segments of the globe. First, are we happy? Well, almost 1 in 3 people will have a serious mental health issue during their lifetime. And more than 1 in 3 Americans feel very lonely. This lack of true connection affects all ages, but especially young adults. And it was exacerbated, of course, by the pandemic. Now, if you ask people what stresses them out, then they will say that work and money stress them out the most. Those are in the lead. But it's closely followed by health concerns. And the perceived stress levels are lowest in adults over age 73 and highest in millennials. And what about our overall health? Well, here's some information sourced from the Centers for Disease Control and Prevention about chronic diseases in the US, and this is a representation by the American College of Lifestyle Medicine. And what you can see here is that 60% of adults have a chronic disease, while 40% have more than one. And around 40% of Americans will be diagnosed with cancer during their lifetimes. Now, we can never prevent all cancers, but we do know that more than a third of all cancers in the US could be prevented. Also, over 1 in 3 people live with prediabetes, and the vast majority of them don't even know that they're on track to developing actual diabetes. And we see more and more diabetes in kids. And now over 70% of Americans are overweight or obese, and these stats have been rising over decades. So now that we've covered the high prevalence of chronic diseases, let's look at the major causes of death. And I chose to show you 2019 here. Not that the order has changed in 2020, except for the emergence of COVID, of course. And in 2020, it was in place 3 on this list with 10.4% of all deaths. But more importantly, if you were to compare this list to the past century, then you'd notice that acute infectious diseases predominated then, whereas today we mostly see largely preventable chronic diseases. Now let's look at the leading risk factors for death. And this is very small print, but the top 5 are dietary risks, smoking, high blood pressure, overweight, and high blood sugar. So at the bottom, you see the top 17 risk factors for disability, and they're very similar. All of these risk factors fuel the epidemic of chronic diseases. So you might say, so what? I was born with my set of genes, my family history, and that's that. But I'm here to tell you, as a geneticist and as a lifestyle medicine physician, that genes alone do not determine destiny. Genetic information determines less than 1/4 of the variation in human lifespan. And until the age of about 70 or 80, lifestyle surpasses genes for health and longevity. And only about 1/3 of your sense of happiness is based on genetics. So you can really make a positive difference in your well-being in any phase of life. Let's look at the positive impact of lifestyle changes and use heart disease as one example. Now, in 2016, a large and comprehensive study of almost 56,000 participants showed that both genetic factors and lifestyle contribute to the likelihood that somebody develops heart disease. Now, it's been known for a long time that genes influence the likelihood of heart disease. And in fact, people with high genetic risk are almost twice as likely to get heart disease compared to those with a low genetic risk. But the main question in this study was whether and to which extent a healthy lifestyle can reduce heart disease regardless of genetic risk. And they looked at several healthy lifestyle behaviors, and they included not smoking, avoiding obesity, regular physical activity, and healthy dietary habits. And as it turned out, genetics and lifestyle were independently contributing risk factors for the development of heart disease, but a healthy lifestyle could substantially reduce the risk of heart disease by the same relative amount in the low, intermediate, and even in the high genetic risk category. So in every single risk category, the risk could be reduced a lot. So even though we cannot change the risk factors we inherit, we can all reduce our personal risk of heart disease by almost half if we have a healthy lifestyle. And that's a huge difference. This unequivocally shows that genes alone do not determine destiny, and it's only one of multiple studies. The risk of developing a chronic disease typically depends on a person's DNA, the genome, right? As well as on the environmental exposures throughout life. And that's also been called the exposome. And then there are the interactions between them. And that's not only true for heart disease, it's also true for all kinds of chronic diseases, for diabetes, arthritis, asthma, depression, dementia, and even cancer. So genetic makeup and environmental factors both influence the likelihood of staying healthy and conversely, the probability of getting a chronic disease. So someone who is genetically susceptible will be more likely to become ill when there is a triggering environmental condition. And conversely, someone who has protective genetic factors may stay healthy despite factors that would negatively impact the health of most people. But how do we look at this? Because there's more. Now, one way of looking at the contribution of the environment has been through the studies of identical twins who grew up in different settings. Given that they have a virtually identical genetic code, anything that is different between them theoretically could be attributed to the environment. But recently, the notion of identical twins has actually been toppled, and now we know that there are differences, especially in gene expression. The way in which genes are expressed turns out to be different in twins who spend less of their lives together, who differed in lifestyle, and who were already older at the time of the study. These findings underscored that gene expression patterns evolve and remain dynamic over time, and that environmental factors play an important role in translating an almost identical shared genotype into different observable characteristics and clinical presentations. It's also clear now that the neatly constructed twin studies of the past were actually not as straightforward as was thought. But then we all know that science progresses and it builds on previously established knowledge. And when new tools of investigation become available, then the old knowledge may no longer be valid. So one application of such a newer tool is shown in this study, which was a 3-month comprehensive lifestyle medicine intervention with nutrition and lifestyle for 30 men with low-risk prostate cancer. And on the right-hand side, you see a pre- and post-intervention heat map that illustrates significant modulation of the biological processes that can play a role in the formation of tumors. So what they saw that some transcripts were upregulated and 453 were downregulated. So gene expression can change in the long term, and we knew that, but also in a short time frame. And that's really significant here. The expression of genes differs between individual people, as we've seen, but also between different cell types within a single person. And that's because the activity of genes is fine-tuned in a highly coordinated way, but it can be different in different organs. So there's a lot of on and off switching, but also instructions like, give me a little more oomph, please, or hold your horses for now. And the way I see it is like an orchestra of regulating players. And the players that I'm talking about include transcription factors, on-off switches, volume control, modulators of gene expression, and other influences. And some of those, interestingly, have indirect instructions. So those can be based on the way our DNA is coiled or chemical adjustments to the DNA. All these gene expression factors are tweaked by external conditions like lifestyle and environmental exposures. So nature versus nurture is much more intertwined with genetic regulation than previously thought. And all of that is studied in the very active research field of epigenetics. All right, the microbiome. Nowadays, you cannot give a talk without mentioning the microbiome, but it is important. So when we think about our roughly 50 trillion cells, we know that in those cells, there are numerous tightly regulated processes that take place. But your cells are not doing all the work. In fact, probably the majority of the cells within our body are not human at all. They're much smaller, but they are very important. We are colonized by hundreds of bacterial species. And the microbiome cells, in a way, are our essential workers. They really influence complex processes, including gene expression. And the microbes in the gut communicate with other organs, including the brain. The interesting thing is that the microbes in the gut actually do much of the calling. So by making your gut happy, you can improve your health and happiness. And the composition of the microbiome really matters. Some of the bacteria in the gut can harm us, but others that colonize our gut are protective against heart disease, diabetes, colon cancer, and even obesity. But let's return to heart disease now. On this slide, you see a variety of risk factors for that. But chronic diseases are not separate entities. Their risk factors impact one another as they are happening inside one body, and they all lead to chronic inflammation. Now, chronic inflammation is a big underlying problem. Inflammation is actually a great defense mechanism, and we all know that, right? Because it's a reaction of the body to harmful triggers. If you have acute inflammation, like an infection or an injury, then the reaction remains localized. The immune system kicks into higher gear, healing is accomplished, and the reaction ends. But that's not what happens with chronic inflammation. There, the immune reaction is not local, and it lingers. It's a continuing signal that something is wrong. And it's also called inflammaging because it speeds up aging. And it causes collateral damage. It harms our organs and it harms our cells. And what are some of the main causes of this chronic inflammation? An inactive lifestyle, obesity, an unhealthy diet, and an unfavorable microbiome. So if all things are connected, we should have a more comprehensive approach to chronic diseases. That's not what happens currently. Currently, they're often dealt with one by one, as if they were independent. But actually, they typically result from an overall poor state of health. Now, we can treat these diseases with drugs, but in many cases, you can actually cut out the middleman, which I think is very exciting news. We now know that we can use food as medicine beyond healthy eating just to prevent disease. Unfortunately, more than 70% of medical schools fail to meet the minimum recommendation of 25 hours of nutrition education. So many doctors may not even know how to begin to effectively address nutrition with their patients. In the medical discipline of lifestyle medicine, that's different. Lifestyle medicine primarily uses evidence-based lifestyle changes to prevent, treat, and when used intensively enough, often reverse disease. And it does it by 6 pillars. And those 6 pillars are symbolized in this figure. First up, there's a whole food, plant predominant eating pattern. That's important. The second one is optimizing physical activity. The third one is improving restorative sleep. The fourth, managing stress with healthy coping strategies. The fifth is avoidance of risky substances. And the sixth is forming and maintaining positive social connection. So in lifestyle medicine, you might very well get a prescription, but it may happen to be an exercise prescription. Now, I like the framework of positive health. There you take the 6 pillars of lifestyle medicine and you combine them with the concepts of positive psychology. And just as a reminder, positive psychology seeks to build what's strong and not only to fix what's wrong. So why is this important? Well, if you want to make a change in your lifestyle, you need to change your behavior. And setting good intentions, like most of us do on January 1st, can get you going, but you need positive emotions to keep you going, to stay motivated in the long run. And with positive emotions, you can nourish healthy habits and vice versa. And that way, you can increase your physical, mental, social, and emotional well-being. Now, this is the slide that shows you why you should care. In the past century, the primary focus was on life expectancy, and major strides have been made, actually mostly by reducing early childhood deaths. And that was achieved with better hygiene, clean drinking water, and antibiotics. But this upward trend has not been sustained in recent years. That's really concerning, because if current trends continue, then babies born today will live shorter, sicker lives than their parents. It's not just about lifespan, it's also about health span. And I don't know about you, but my goal is to add years to life and life to years. Basically, what I want to do is square this curve. But what we see today is that for many people, deterioration starts at the green arrow, so fairly early in life, and then there is a slowly continuing degradation of quality of life, often ending in a premature death, with a lot of disability along the way. And most people actually don't want that. Now, you might say, aren't most of us living a pretty healthy life, though? Well, let's have a look at that. The Mayo Clinic researched the prevalence of a healthy lifestyle in a representative sample of almost 5,000 people. And they defined a healthy lifestyle by 4 things. First, moderate or vigorous exercise for at least 150 minutes a week. That's 30 minutes, 5 days a week. Moderate exercise, just for reference, is a brisk walk, right? The second one was being in the top 40% on the healthy eating index. So the top 40% is pretty generous. Then a normal body fat percentage and not smoking. And what percentage of people do you think lived a healthy lifestyle? Drum roll, less than 3%. Yikes. So all this information is relevant for patient and for you. Also in light of the rampant rates of burnout in healthcare. So I ask you today, which aspects of your health and well-being can use a boost? Because every step you take is one step on the path to health, well-being, and fulfillment. And with that, I'd like to thank you for your attention. You can learn more about my work at the website, and please feel free to contact me anytime at the email on the slide. And I'd be happy to answer your questions.
Thank you so much, Dr. Schrijver. We really appreciate you. Oh, yeah, that's great. So everyone be thinking of your questions if you got them. All right. Thank you so much, Dr. Schrijver. We really appreciate your comments. This has been enlightening and has been a great addition to our conference. Yesterday, we've had a lot of science presented to us by Dr. Tollefson, by Dr. Greger, and we have really just been enlightened a little bit. And then your science has really come in and kind of solidified this and allowed us to connect some of these lifestyle habits to our genes and really provide some proof that this is functional. So I would just like to open it up to everyone to see, do we have any questions from the audience?
Hi, thank you. That was great. My question has two parts. There are a lot of new companies coming out that study genomics, and we can order tests for these, allowing us to kind of give patients some information regarding their genome. And there's other ones which I find really fascinating that are more of a study in proteomics, which I kind of think of as the phenotype of the genomics. And I was wondering if you had an opinion or a comment on these new technologies in healthcare.
Yes, absolutely. And that's a great question because, as I said in my talk, science builds on what was known before. And I started as a clinical molecular geneticist working in inherited genetic diseases. And over time, my practice really evolved and involved cancer, so acquired genetic diseases as well. And in time, of course, genomics came around, and we probably cannot imagine doing anything in terms of cancer diagnosis, prognosis, minimal residual disease testing, etc., anymore without using some form of genomic testing. So these tests are incredibly important, and at the same time, there is still a lot to learn. So when we do genomic testing for cancer, it's still a limited number of changes that we can look at, even though we're looking at a genome or exome level. And there's also still limited understanding about a variety of different cancers, especially the more rare ones. We may see a change that is, a common bad player in cancers in general, but there are also specific changes that we may not yet completely understand. And I would say with proteomics, which I completely agree with you, is a really exciting next step. There we would really look at how the genome is expressed and what it actually does on the protein level. And that's where the most important development would be. But I say would be because I don't think we're quite there yet. There isn't a whole lot out there in terms of proteomic testing that that is clinically validated or that is at this time very much added value. There are lots of companies that claim that there is a lot of value in such testing, but I think it behooves us to look at what academic centers are doing, what is available in the published literature, and also whether patients are paying for something that is called a study or not. So this is often seen with the microbiome, for example, where people are paying to get their information and it's called a study, but actually it's just a commercial service. Nothing wrong with that, but complete disclosure up front is important. So baby steps, but I think we're making great steps forward.
Great question.
Is there time for one more?
There will be time for you.
Okay. Any specific studies on specific genetic conditions that run in families like BRCA and Czech and Lynch syndrome? As far as whether lifestyle modification has had an impact on families that have those conditions, and how you even separate out those studies when you consider that they're getting screened for cancer more than the general population.
I had a hard time hearing the question. I think you said, how do you start separating this out in families where there is more cancer, for example? How do you separate that out from nature versus nurture, right? You can only do these kinds of studies when you look at large numbers. So individual statistics are never really useful. Everybody knows somebody who smokes, who drinks, who does only couch surfing and still lives to be 100. So if you look at an N of 1, you can say nothing. But it's by looking at many families, by looking at and controlling for factors as much as possible, by looking at large populations, that these trends become clear. And so there are families that have a predisposition to cancer, for example. So you could, for example, compare one of those families with another family that has the same predisposition, and maybe one of the families has a very unhealthy way of living, and that's actually what I would like to think of as an inherited factor, because we get so much from our parents, from our family, in terms of culture, in terms of traditions, in terms of what we like to eat or what our activity level is. But if you compare such a family with a family that actually has a very healthy lifestyle, then you might very well see differences. And if you do that for numerous families, as many as possible, then these trends are pretty clear. So twin studies have been important in this, family studies have been important in this, and large population studies especially are very, very valid and valuable.
Thank you so much. We really appreciate you being present and recording this lecture, and then being here to answer our questions. Your input has just been invaluable to us, so I appreciate you, Iris. Thank you.
Thank you.
All right, now we'll go downstairs and we can listen to the keynote, Chris McDougall. Thank you. Thank you, Iris.
Thank you.
Bye. Oh, yeah, before you go, we got one more question for you.
Oh.
I was wondering, how much, I was just very curious about how the mind and meditation might influence what you know about that issue.
Yeah, that's a wonderful question, actually. We do know that meditation makes a big difference in things like blood pressure, in overall outlook, and that it has health benefits. Mindfulness-based stress reduction is a proven program in the workplace, but also for people individually. I have not seen a study on meditation and gene expression, but as you know, if you look at the 6 pillars and meditation, or some sort of mindfulness practice, be it might be prayer, might be meditation, might be forest bathing, as we heard this morning. Any of those practices, of course, also nourish our entire well-being.
Right.
And so I think it's only logical that it would also be able to change our gene expression by lowering stress levels, for example, and also by making this very small change over a long period of time. If you start with 2 parallel lines and one just moves away from the other a tiny little bit each day, then you end up in a very different place after a while. So it's a great question. I'd love to see such a study.
Oh, okay. I didn't know that there weren't that many studies with meditation and genetics, but I know that with Herbert Benson's work and the research that they did in Harvard, they showed a correlation between meditation, oxidative stress, and inflammation for sure.
Yeah.
So there's a biological component to it that is already shown in one area, but I just wondered if you knew about the genetics part, but thank you.
Yeah.
Yeah, hi, thank you for a great lecture. I heard about fasting mimicking diets. I think it was by Dr. Longo, and how I thought it was fascinating, some of his research that showed that you could reverse type 1 diabetes in animal models by stimulating the embryonic progenitor cells. And I guess I'm wondering how that works genetically, if at all, and if there is that connection by going on that fasting mimicking diet, then the whole food plant-based diet thereafter to help out, which can then possibly reverse some of these, what we thought were irreversible diseases.
Yeah. I think it would go beyond the scope of this lecture to really go into the genetics of the embryonic cells that are stimulated by the fasting mimicking diet. But it does illustrate very clearly that we have this capacity of renewal, that once we take away the toxic component, and that's what you see in diabetes, right, which is basically a fat toxicity, that then you have that regenerative capacity to actually get back on track and heal yourself. There's no doubt that there are many different genes involved in making that happen, and yeah, this goes for diabetes and for other conditions as well. Not for everything. I think once you have cancer present, for example, you will probably need a combination of things to optimize the healing of the patient. But for diabetes, if the diabetes hasn't persisted for more than about 6 years, there certainly is that possibility of complete reversal of disease.
Thank you.